Hello, my name is Jean-Paul Ducre. I'm a senior at the University of Louisiana at Lafayette, and I'm doing a public service announcement for a Health 412 class, Health and Sexuality. The topic today is going to be pelvic inflammatory disease. Pelvic inflammatory disease, or PID, is an infection of the female reproductive organs. PIDs typically occur whenever bacteria from an STD travels from the vagina up to the uterus and eventually the genital tract. Here are a few causes of PIDs: having numerous sexual partners, intrauterine devices, abortions and miscarriages. Douching too frequently may disrupt the proper balance of bacteria and also mask symptoms or early warning signs of a PID. And also having a prior history of PID or sexually transmitted disease. By refraining from unprotected sex, one can increase the chances of limiting STDs, which eventually lead to a PID. Very limited testing capabilities are available for a PID, which is why you must seek a physician's assistance. The doctor may take blood samples or have an ultrasound to see any organs inflamed or that look damaged. The doctor may perform a endometrium biopsy, which is a removal of a uterine tissue sample. The last form of treatment is a laparoscopy, which is when the doctor makes a small incision on the abdominal area and inserts a lighted tube to view the organs inside. Early symptoms or warning signs for a PID: pain in the abdomen, fever, an unusual discharge with an odor, pain during intercourse, burning during urination, and bleeding between periods. Chronic symptoms if left untreated: scar tissue on fallopian tubes, which may lead to blockage, ectopic pregnancy, where the baby may form outside of the womb, infertility, and abdominal pain. Two common antibiotics found on the market are Rocephin and Mefoxin. These can be taken orally or, in the case where a woman must be hospitalized, intravenously. Nationwide statistics. Each year, from 1980 to 2012, roughly 282,000 women, ranging from 15 to 45 years old, have been treated for a PID. Statewide statistics, according to the Louisiana Department of Health and Hospitals, states that Louisiana ranks #1 in gonorrhea and also #2 in chlamydia rates throughout the state. Chlamydia and gonorrhea are two of the most common that are known to cause PIDs. Remember, men cannot contract a PID, but they can be carriers of chlamydia and gonorrhea that lead for a woman to get PIDs. Additional info regarding PIDs: there is no actual test for a PID. The doctor will look at your past medical history, may take an ultrasound or a blood sample, or even go to surgery procedures, but these are still limited. Pelvic inflammatory disease occurs only in women and is typically triggered from gonorrhea or chlamydia. There's a 90% rate of women who claim to have an asymptomatic case, and 10 to 20% of women with an STD will get PIDs.